na lifestyle yake.
Na lifestyle yake.
Umesema mpaka kunywa pombe inaweza affect.
Kunywa pombe ina affect sana, ina reduce the sperm count, even the smoking also, and use of other like marijuana. It can affect due to tubal factors. Like I think umesikia kitu inaitwa fallopian tubes in female, so inaweza block. So second factor can be because of tubal blockage. That is in female. And then the third can be problems with the ovaries, hormonal problems. That's one.
Herbal medicine.
That is a very good question. So for the class we get, in fact,
how are you? Unaendelea vipi? Niko salama. Naitwa Princess. Karibuni sana kwa channel yangu ya YouTube. Kama hujasubscribe, please subscribe. Kama umesubscribe, asante sana kwa kuwa part of Princess Online Family. Karibuni sana kwa video yetu ya leo. Tumepata a learned lady ambayo tutazungumzia issue ya health, specifically health kuhusu wanawake na wanaume. Kwa hivyo nataka nimkaribishe, nikumshukuru sana kwa coming to my channel. Karibu sana, utuambie wewe ni nani na unafanya kazi gani?
Yeah, thank you so much. I'm Dr. Amy Soy. I'm a gynecologist by profession. I practice mainly in Eldoret town and also Kapsabet, Nandi County. Gynecologist.
Karibu sana.
Thank you so much.
Yeah. So nataka utuelekeze, just guide us on a few areas. Specifically, we want to talk about infertility. Watu wengi wanataka watoto alafu hawajafanikiwa kupata, ama kuna shida hapa na pale alafu hawajapata. Na sana sana ukiangalia most of our communities wanasema kwamba mwanamke ndio ubeba challenges mingi when it comes to infertility. So nataka leo tuone, is it ladies peke yao ama pia wanaume wanaweza kuwa na challenge? So karibu sana, utuambie what are the causes of infertility?
Thank you so much. So I'll start by introducing the meaning of infertility. Infertility means that if a couple has been trying to get pregnant for around 1 year without succeeding, if we are less than 35 years. But if we are more than 35 years, it reduces to 6 months. And it can affect both male and female. In the world today, it is becoming more common. Like 1 in around 5 couples has primary infertility. Primary infertility means inamaanisha mtu hajaipata mimba hata siku moja. And then 1 in 20 couples wako na infertility, they have secondary infertility, which means wameipata mtoto maybe moja, from there hakuna mtoto mwingine. So hiyo ni secondary infertility. So it's common in both male and female. And in when you go to world statistics, around 33% of infertility is attributed to female factors. 33% is also to male factors, and 33% is to both, and or also idiopathic. No one knows the cause. So the main causes of infertility is divided into around 4. So you can have sperm issues. We have abnormal sperms. It can be too low, or it can be just that it is the structure is not normal. So that is one. Second, it can be due to tubal factors. Like I think umesikia kitu inaitwa fallopian tubes in female. So inaweza block. So second factor can be because of tubal blockage. That is in female. And then the third can be problems with the ovaries, hormonal problems. That one. So for hormonal, it is a axis, is a pathway from the brain all the way to the ovaries. So sometimes due to other factors like disorders, it can affect that pathway, and it leads to the ovaries not producing eggs or the testes not producing sperm.
Sperms.
So third is hormonal factors. And then in female also you have uterine factors. So that is the fourth one. I was saying we have 4 factors. So in uterine factors, you can have ladies who sometimes they stay for long without conceiving, then they get fibroids, or even because of genetic factors. So if you have masses in the uterus, it means it will lead to infertility because the baby will not have a place to sit. Because usually after fertilization, you need a place to sit and then grow for 9 months. So that is uterine factor. So if they, and then also there is something called endometriosis, where during menses, instead of all the menses coming out, some of them cause an implant in outside the uterus. So that is the uterine factor. So it can be because of endometriosis, it can be because of pelvic masses or fibroids. So those are the main causes of infertility. But then I need to talk further about the causes, because now we have causes, then we have the risk factors. So do you have the risk factors that increases what makes somebody to be infertile? So for the risk factors, there are too many. There are some that are common to both male and female, some is common to male, and some is common to female. So first we'll start with the risk factor is age. For both male and female, as age progresses, for example, for female, mtu akipita 35 years, fertility ina reduce automatically. Inashuka. For men, wakifika 40 years, pia sperm inaanza to reduce. So age is a important risk factor. Then there is also lifestyle. For somebody who is not eating well, not eating a balanced diet, is taking a lot of alcohol, you are smoking, you are not exercising, chances of infertility increases. And then we have genetic factors. There are people who have other genetic conditions, like for example SLE. There are connective tissue disorders that can affect infertility, genetic diseases. So if you have some, even diabetes, other, even hypertension, it can affect infertility. And then we have also things like radiation, chemoradiation. Those people who are on cancer treatment, when they do radiation and chemotherapy, usually it destroys the cells of the testes or the ovaries. So that one can also increase the risk of infertility. And then people also who do over exercise. Exercise is good in moderation, as far as infertility is concerned. But if you over exercise, then you will also lead to effects. For example, athletes, wale watu wanakimbia sana, huwa wana miss hata menses, paka hata ina reduce the sperm count.
Kuna kitu you spoke about, was it a fallopian blockage? Yeah. Is there something that causes for it to block, or it just blocks?
Okay, for the tubal blockage, it is one of the commonest causes of female infertility. And the reason why it's blocked is because of untreated infection. If somebody gets infection, maybe it's a sexually transmitted disease, or a genital infection, or even a TB of the pelvis, then it usually blocks the tubes. So it is important for somebody to go for treatment early, as soon as they get the infection, so that they don't get the tubal blockage. Sometimes it's because of also the tubes can get destroyed also because for example, if you go for surgeries, for example, surgery for ectopic pregnancy, if somebody gets a pregnancy in the tube, then you go for surgery, and then it will block.
Okay. Does it affect, now talk about this blockage, does it affect someone who is younger? Say that 35 and below.
That one is no age. Yeah, it can affect anyone.
As a general factor.
As a general factor.
There seems to be lots of factors that can make people to lower their fertility levels. So how do are there remedies for this infertility process?
So there are remedies. Now that there are causes, usually for all causes, there are usually remedies. So for remedies, we'll start with what is common to both male and female. That is lifestyle modification. You need to modify your lifestyle. Say that you are taking a balanced diet, you are doing moderate exercise, you are not taking you are not smoking, you are not taking alcohol. You are going for medical checkups, so that if there is any diseases can be treated early. If you are going, for example, for cancer treatment, then we advise hiyo mayai itolewe ipelekwe storage so that they are not destroyed by iwekwe kwanza so that is destroyed na radiation ama cancer medication. So we usually advise when patients come for treatment. So another remedy for that one is before you get the infertility, but if it has already occurred, then it depends on the on the cause. The treatment, the remedies depend on the cause of that for that particular patient. For example, if somebody is not ovulating, maybe it has an hormonal problem, sometimes you give a ovulation induction medication. I think when you are meskia, clomid, nini, the patients who have been coming, hiyo ina trigger mai, you ovulate, it's okay. Then ikitoka, then it will be fertilized. Sometimes we also even for the male, if they have low oligospermia, which is low sperm count, kuna dawa ya kuongeza sperms, ya kusaidia sperms ikuwe mzuri na ikuwe iongezeke. So kuna medications, lifestyle modification, medication, and then sometimes we also do surgery, like for tubal blockage. Kama imeblock huko kando kanda, sometimes tunafanya surgery or we do laparoscopy. It can be open surgery or laparoscopy. Sometimes tunafanya surgery.
So ata fibroids,
ata fibroids pia tunatoa. So surgery is one of the option, one of the remedies. And then medications, then lifestyle modification.
Mtu wa balance.
Mtu wa balance.
Chakula na lifestyle yake.
Na lifestyle yake.
Umesema mpaka kunywa pombe inaweza affect.
Kunywa pombe ina affect sana, ina reduce the sperm count, even the smoking also, and use of other like marijuana. It can affect all those drugs.
Okay. So easy treatment zenye umetuambia kama surgery easy ama dawa. Does it cause other diseases sasa? Ama surgery ni clean hivyo?
It is clean to okay, that one is just to open the blockage. Because you know tube is around 14 centimeters long. So wakitaka kama imeblock huko mwisho, inaweza katwa ikuwe wazi ndio allow mai ingie.
So si ati iko na side effects na mbele inasumbua mtu.
Okay, inaweza all surgeries of course iko na side effects because it can give you pain, inaweza kuuma kwa muda mrefu. Ama hata it cause additions, it cause in more blockage. So saa zingine instead of doing surgery, there is modern treatment nowadays like IVF, which we use. The problem is that it's expensive, but now it is the main thing nowadays.
This thing inasaidia. Okay. So kuna umesema infertility in women iko slightly higher than ile ya men.
It's almost the scale is almost the same.
Okay.
Si mbali sana.
So it's both. Unajua in our African setup sana wanaangalia from a lady's perspective.
Yeah, I know. But nowadays it has changed. We get so many men coming to our clinics also.
So pia wanaume
wameanza kukuja kwa wingi sana. And now we have a lot of medications even for treating male infertility, even in our clinics.
Wow. Alafu sasa ukiwa mtu akiweza kuja kwenu anaweza pata hataki easy hospital medicine. Do you think ni mzuri mtu aende kwa herbal medicine?
That is a very good question. So for the clients we get, in fact, we get after they have gone for herbal medication for around even 2 years before they come to us. So we usually receive them after they have tried all the herbal medication. Now it has not been successful when they come. The problem with the herbal medication is that it has not been taken for testing. So we don't know the contents, what it contains. It's like trial and error. You can iko na nini. So people usually move from one herbalist to another. So some of them, they even come to us after 10 years. So we have been So we have been advising people to come to us early because we can test and we know what is the problem. You know the problem with the herbal, they give you medication without knowing the cause of your infertility. Because every patient has a specific cause.
Daktari, kuna wale wako permanently kabisa infertile. Are there such cases? Like Kenya haiwezi saidika kabisa?
Hakuna. We always have a solution for each and everyone.
So, kuna solution.
Kuna solution kwa kila mtu.
Kwa kila mtu. So ukifeel usione kama yako imekuwa kubwa
sana. No, hakuna. Hakuna. So if somebody has even lost the uterus, they can do surrogacy. So that's another treatment. That's another treatment. Which is available now, and we get now patients coming. So we have so many who are doing surrogacy.
Now, for how long now have you been a gynecologist?
For more than 10 years. Wow. Since I finished my medical school, I've been doing gynecology only.
So umesaidia watu wengi?
Watu wengi sana. I'm proud of my work, and I have so many people with testimonies.
Umepata watoto wamerudi vizuri?
Wengi sana.
Okay.
Very many.
Yeah. So what's your last take, daktari? Sababu unaona umetueleza vizuri na tumeridhika. Of course mtu akisha watch the video anaweza pia tafuta gynecologist.
But I want to mention a bit before we do to the last check about IVF. So IVF is called in vitro fertilization. This is where if somebody is has a very serious issue or cannot conceive completely, they can consider IVF. So IVF is where they can take the sperm from the husband or the partner, and then the egg, then they combine the two in a test tube. And then once they form the embryo, after around 2 days, they can now take it to the woman uterus. And that one is very available, and and most of the time we use it nowadays. The problem is that it's expensive. It might cost you around 500. Kwa pesa mingi sana, around 500,000, but at least somebody will get a child.
Hii ni kama the man sasa hawezi ama pia either.
If one of them hawezi, then most of them will resort to IVF nowadays.
But expensive, lakini
inafanya, and watu wamepata watoto.
Na mtoto atakuwa both wenu.
Ni wenu. They take your egg and yes. And the baby will turn out to be normal, because watu wengi wanauliza hii IVF nitapata mtoto kawaida? Mtoto ni kawaida, anaenda shule, anafanya kila kitu just normal. It's just assisted reproduction. Watu wanaogopa sana. It's called assisted reproduction. Umeassistiwa tu, lakini mtoto ni wako na ni kama watoto wengine.
Genes ni zako.
Kila kitu ni zako.
Wonderful. I think we'll do another video tueleze, kwa sababu nayo mambo ya pregnancy na mambo ya kupata watoto, family planning. There's a lot of topics that we might have to find you and tueleze, sio?
Kwa sababu hii ilikuwa tu introduction, because there are so many people in the community who are suffering without child. You know, kama huna mtoto, you are psychologically disturbed, emotionally disturbed. You might even get depression. So it's good to, for those people who have that problem to come and look for us. Tutafuta wakuje, tutasaidia.
Thank you so much. Asante sana for coming through. We have not met, by the way. This is the first time we met. You're such a good person. Thank you so much. Asante sana.
Welcome.
Yeah. Keep watching, keep subscribing. Till next time. Asante.